Hello everyone, greetings from Marwadi University. Today we will be learning on the topic of Spina Bifida. I am Dr. Pooja Vora from Faculty of Physiotherapy, Marwadi University. So, first of all we will learn about the basics of the development of the spine. So, if we want to see or if we can see this figure, the figure tells us that this is a normal spine. We have cervical spine, we have thoracic spine and we have lumbar spine. And these are the pictures of the vertebral column, where we have seen that this is vertebral foramen, this is the body of the foramen, and these are the various parts of the spinal cord. Now, we need to understand that where will be the problem if we have spina bifida. So, just to understand that, first we need to know the term what is spina bifida. The term itself says it is spina and bifida. That means any of this spinous process of the body or of the vertebral column will be divided. That means there will be two spinous process, that is bifida dividing into two, right? And spina means it is spinous process, bifida means dividing into two. So, any of the spinous process when it divides, when there is any abnormal development and it divides, then we consider it to be spina bifida. Definition: spina bifida, a Latin word meaning split spine in general, is defined as developmental congenital disorder that is caused by incomplete closing of the embryonic neural tube. Some vertebra overlying the spinal cord are not fully formed and remain unfused and open. So, if we can see from this figure, we come to know that the spinal cord that has been formed. Now, we know that when the embryo starts developing into the mother's womb, then the first thing that comes up is, or the first thing that builds up in your body is your spine. Fine. That is why we will get a structure to our body. So, this spine, when it is improperly developed, then we can consider it to be a problem, a neural tube defect, because in the development we give this name to the spine as neural tube as it develops from the neural tube, and when there is some problem in the development of this neural tube, we can consider this problem, that is spina bifida. Now, if we consider the etiology, why this spina bifida problems or develops, then we have maternal diabetes, we have genetic causes. So, if we consider the etiology, then the first etiology is the maternal diabetes. Why maternal diabetes? That means if the patient, the mother is having diabetes mellitus, then there are chances that there will be some problem in the development of the neural tube. Then comes is the genetic causes. What do you understand by genetic causes? Any causes or any problem due to the altered gene in the body. Fine. Now, this altered gene will be in the mother's body, and the altered gene can be from the father's body also, because the embryo develops from the genes of mother and father both, right. So, any altered genes will cause or may have the problem to the neural tube. Then is the low level of maternal folic acid and hyperthermia. Maternal folic acid, that means the folic acid in the mother, that means the iron content in the mother, if it is less. Now, if the mother has low hemoglobin or if the mother has thalassemia or any other problem, then the folic acid in the mother will be less, because of which there are chances of development of the problem, this specific problem, that is spina bifida. Fine. And that is why nowadays you must have learned or you must have known that the mothers are given lot many supplements when they are pregnant. That is why these supplements will help development and will reduce the chances of getting any genetic disorders. Fine. Then maternal use of valproic acid or anticonvulsants. If the mother is epileptic, the mother is taking anti-epileptic drugs, then the mother may have the problem, and that is why that may lead to some development problem in the mother, in the womb of the mother, the baby's development. Fine. So, this is the etiology of the spina bifida. Now, coming on to the embryology, that means what happens in the neural tube because of which we will have a problem. Fine. But this is the basic normal embryology that we will be seeing. The first one, or at the 21 days when the baby is born in the, or the womb is, the embryo is growing in the womb, then at the 21 days, this is how the picture of the spine will look like. Then at the 22 days, how the picture of the spine will look like, and at 21 days, how the picture look like. Now what will happen is, here you may see this problem. Here you may see this problem, that is spina bifida defect. That means here when the body is growing, when the spine is growing, this should be closed. Slowly we are seeing that this is getting closed. This is getting closed, but here we can see that this is not getting closed. The below part is getting closed, but the above part, there is some problem in the closure of the vertebral column, and this will lead to spina bifida. Okay. So now this is what the picture says, and this is what we have seen. What will happen? The caudal end of the neural tube closes, which will lead to failure to close, which will lead to spina bifida. Fine. Now what are the various types of spina bifida? Spina bifida will be of 3 basic types that we will be seeing. This is what the normal spine that you can see will be there. Then this is spine, the first type is spina bifida occulta. In occulta, what will happen is, here there will be only problem with the structural issues of the vertebral column. The nerves, the meninges in the layer of the spinal cord, the covering of the spinal cord, which is known as meninges. So this is what is the spinal cord, and the cord which is the neural tube or the nerve fibers. There is a covering of this nerve fiber which is known as meninges, right? And now in the spina bifida occulta, only the vertebral column will be split. There will not be an issue with the meninges or the spinal cord. Then is meningeocyl. In meningeocyl, what will happen is, the meninges, which are the covering of the spinal cord, along with the problem with the vertebral structure, the meninges will also come out. Fine. So the meninges will also come out. So that is meningeocyl. And here we have seen, we can see here also in this figure that the meninges is coming out, the spinal cord is intact. Then comes is the myelomeningiocyl, where this nerve along with the meninges also comes out in the spina bifida. Fine. So we have seen 3 types of spina bifida. The first is occulta, where there is just the issues with the structure. The second is meningeocyl, where the meninges are just coming out, but the nerve fibers are intact. And here this is myelomeningiocyl, where the meninges along with the neural tube or along with the nerve fibers also come out, and that is why we will have more of complications if we have myelomeningiocyl, because here this only there is an accumulation of the, or there is an protrusion of the meninges, but here along with the protrusion of the meninges we will also have the nerve fibers. So when the nerve fibers are coming out, it is definitely going to affect the lower part of your body. Depending upon which area of the spinal cord is affected, you will have the issues with the respective part in the body. The first one, as I said, that is spina bifida occulta. Now how would you be able to identify that it is just occulta? Because we are not having the X-ray to see that, or normally we don't come to know that if you have any issues with the spine until and unless you are going for the sonography, the detailed sonography. So in the detailed sonography itself, there will be an idea that the spine will be an issue or the spine is deformed. So the doctors will definitely tell the mother, and it will be easily identified in the 3D sonography. Now what will happen? If the patient has spina bifida, and if the mother wants that my child should be getting a normal healthy life, then is it possible or not? Then if we see in the first part or first type of spina bifida, that is spina bifida occulta, then what will be the picture that we will see? This is the picture that we will see, that is the tuft of hair. The tuft of hair that we can see in this picture, the hair-like structures that will be seen only outside the area where there is spina or bifida. That means there is a bifid of the spine. So here we know that when only structural is an issue, the patient will not have much of the problem until and unless it is getting swollen or it is getting some other issues or infection or any sort of thing. Fine. Only the tuft of hair will be seen on the part of the skin where we have spina bifida. So that is spina bifida occulta. Here mostly the meninges, as we know, and the nerve will not be affected. The common site for this defect is lumbosacral area. Fine. So in the lower lumbar area and the sacral area, this will be the common site of defect where we have this issues, or commonly it is found, and there will not be any disturbance of the neurological or musculoskeletal functioning. Why? Because it is only the structure which is affected, no nerves or meninges get affected. Then comes this meningeocele, where the meninges also come out along with the bifid spine. So what will happen here? Here there will be a cyst which will be formed in the meninges will only be there into the cystic sac. The spinal cord will remain intact, and that is why the clinical signs vary or may not be apparent also. And this is relatively uncommon form of spina bifida, that is spina bifida cystica. Why do we call it as cystica also? Because a cyst like structure is formed when the meninges also protrude. Fine. So here the spinal cord is still intact, so there will not be much of the damage, or there will not be much of the symptoms that will be present in the patient. But this, as we said, is a bit rare condition. This is either common, or then this myelomeningeocele is common. Now what do we understand by myelomeningeocele? Here we have seen that the spinal cord, the blue part that we see here, along with the meninges and the nerves, everything gets come out in the form of a sac. So when everything is protruded, now imagine that if this is the whole string, and from the string we are pulling the things away, then what will happen? If the string is connected above to some one another content or some one another structure of the body, then what will happen to that structure? That structure will also be pulled down, right? So this is the sac which will cause lot many problems, because now the nerve is also getting involved. In the myelomeningeocele, it is the most common in thoracic and lumbosacral regions. It occurs in 94% of the cases. As I said, either first or the last one is more common. It has 2/3 of the open lesion involved in the thoracolumbar junction, and the terms myelodysplasia and myelomeningeocele are also frequently used interchangeably. So if you are asked, or if you are talking to some of the medical persons, when you are going to the to see the patients, or when you are meeting some doctors, and if the doctors also tell you about myelodysplasia, then you should not be confused. Spina bifida, myelodysplasia or meningeocele, they are the common terms which can be interchanged, right? So from this figure we come to know that the symptoms will be very common, or like it will be injuring the patient a lot, because we have seen that along with the meninges, the nerves are also protruding outside. So when these nerves are getting damaged, definitely at whatever area, suppose if we say it is a lumbosacral area, so in the lumbosacral area, if there is an protrusion of the nerves of the spinal cord, then definitely we will have the paralysis, or we will have issues with the lower limb, both the lower limb. So the patient will have issues with walking, the patients will have issues with the weakness of the muscles and all the problems with both the lower limb. Fine. Now what can be the clinical features if you have spina bifida? The common clinical features that we see is sensory, musculoskeletal, orthopedic, neurological, psychological, growth and nutrition. Now we will see each of the clinical features in detail. So let us look for all the clinical features in detail. The first one are the sensory impairments. So when we think of sensory impairments, we know what do we understand by the term sensory. That means the sensations of your body. Fine. So children with spina bifida have impaired sensation below the level of lesion. So wherever is the level of lesion, either it may be thoracolumbar area or it may be lumbosacral area. Wherever it may be the lesion, you will have loss of sensations. It includes kinesthetic, proprioceptive and somatosensory information. So kinesthetic, that means any sensations related to the movement. Proprioception, that means any sensation related to the joint position sense of your body, right? So sometimes you must have heard from the patients that patients would tell you that I am not able to feel the lower part of my body, or I am not able to feel the limb of my body. Now when they are not able to feel, there is some issues with the sensory perception or the identification of the sensations, right? So because of this, the children will often have to rely heavily on vision and other sensory systems to substitute for this loss, right? So what will happen? Now we know that when we have loss of sensation, then what will happen? How we will be able to balance, how we will be able to work in our day-to-day life? Then there are other sensory systems which will compensate this loss of sensation. So what are those other sensory systems? We have visual system, we have auditory system, so that will also help to compensate. So suppose if I am walking but I am not able to understand or I am not able to feel, but yet I am able to walk. Why am I able to walk? Because I can see, I can hear the sound. If anybody is coming in the surrounding area, I can hear the sound, I can see, and I can just walk further. Maybe my speed would be reduced, or maybe I may not be able to walk properly, maybe I need some assistance, but I will be able to at least walk because I have the other sensations which will compensate my sensory loss, right? Then musculoskeletal impairments. What do we understand by the term musculoskeletal? In musculoskeletal, we understand by the terms of in terms of muscles, right? So in muscles, or we can say in the terms of the bony changes that can happen in our body, right? So at birth, two main types of motor dysfunction in the lower extremities have been identified. The first one involves the complete loss of function below the level of lesion, and resulting in the flaccid paralysis, loss of sensation and reflexes. Now we know that when the muscle goes into flaccidity, then definitely the reflexes will also be reduced. Now what do we understand by the term flaccidity? That is a complete loss of the tone of the muscle, right? What is the tone? A normal strength or a normal tension that is present in a muscle. Everyone has a normal tension that is present in a muscle. Now why the tension occurs? The tension is because of the continuous nerve supply to that area of the body. Now suppose that nerve supply has been damaged because of any reason. Here we know that in the myelomeningeal seal, where we saw that our the nerve fibers were also getting excluded, or they were also coming out along with the meninges, then the nerve fibers would definitely be get damaged. So when the nerve fibers get damaged, then we will have flaccid paralysis. Then if the spinal cord remains intact below the level of lesion, the effect of an area of the flaccid paralysis immediately below the level of lesion and possible hyperactive or spinal distal reflexes to that area. Fine. So this condition may be quite similar to other neurological state or of the severe cord seen in the traumatic injury also, right? But how can we differentiate it from the traumatic injury? We know that it is because of trauma, and here it is by birth, fine. So this is way we can differentiate. Then we will look for the orthopedic deformities. What happens in orthopedic deformities? We can see here, that is the scoliosis, the change in the curvature of the spine, fine. That change in the curvature of the spine we can see here, and it is over kyphosis. So if we see, look for the lumbar spine, and if we look for the thoracic spine, then lumbar spine we have seen that it is over exaggerated lumbar lordotic curve that we can see, and over exaggerated kyphotic curve that also we can see, fine. Then we may have club foot, we may have lumbar lordosis, we may have hip flexion, knee extension and ankle dorsiflexion contractures also. This is the picture of the club foot. Club foot means the patients will have the ankle in internal rotation, medial side it will be rotated, fine. Then comes the neurological impairment. Now neurological impairment, definitely we know that when the nerve, here we have seen that the nerve is coming out along with the meninges. So it is going to cause some problem with the nerves. That means we will have hydrocephalus. That is when you have, or you can say it to be a complication also of the spina bifida or the myelomeningeal cell. Hydrocephalus, that is whenever you have accumulation of the excess amount of the fluid. Find that excess amount of the fluid or the cerebrospinal fluid which is not draining, which is not drainage, or the drainage of the cerebrospinal fluid is affected, then we will have this problem. Why we will have this problem? Because we can see here that there is a sac-like formation, and the cerebrospinal fluid also passes through this spinal cord. So the cerebrospinal fluid also will be accumulated along with the nerves. So when the cerebrospinal fluid is accumulated, there will be problem in the drainage of the CSF fluid. So you may have hydrocephalus, Chiari malformation. That means there will be herniation of the brain. Now we know that this spinal cord is connected up to the brain, the lower part of the brain. So when the lower part of the brain also gets pulled, here, if we just pull the thing here that is coming out, then the lower part, the string, this, if we consider this as a string, the spinal cord, then it is attached to the brain. So the parts of the brain will also be pulled down. So that is Chiari malformation. Then tethered cord syndrome. Now what do you understand by the term tethered cord? Tethered cord means here the end of the spinal cord, it will attach to the vertebral column. Ideally it should be free. The spinal cord, it should be free because it is a nervous structure and it requires some bit of mobility. Otherwise, if it gets adhered, then you will have issues. So that is why the spinal cord here, it gets tethered and it gets adhered to the spinal, the vertebral column. So that is tethered cord syndrome. If you have these issues at the sacral level, then definitely bowel and bladder function will also be affected. Then cognitive and learning disabilities. Now we have seen that when we have cognitive issues or learning problem with the brain, the lower part of the brain, as I said, is pulling down. So when it is pulling down, it is affecting the other functions of the brain also. So one of the important function of the brain is cognition. Now what do we understand by the term cognition? Cognition means the understanding of the commands. Now suppose if I am talking to you right now, then you should be able to understand what am I talking. Then you will be nodding your head. If you have any questions, you may ask. But when you will be able to do that, when you understand what am I telling, fine. So that is cognitive. And learning means whatever I am telling. Now suppose we all must have seen that movie Tare Zameen Par, fine. What was shown in that movie? The child was not able to understand properly how the numbers and the letters were going on. So he had mistakes with understanding, identification of the letters and numbers. So that is a type of learning disability. So that also can occur. Psychological impairments. Now when we have seen that there are many complications occurring because of the myelomeningocele, then those complications will make our patient dependent. So when it makes our patient dependent, definitely we will have the issues with the psychological component. Now suppose if he or she is a child, definitely this is by birth. So the children, when they grow, they will have issues with cognition, but all of them will not have a major issue with cognition. So they will be able to understand that their peer group is not they are playing and they are not able to engage in that peer group. They are doing all sort of activities, but these children who are having some issues with their lower limb, they are not able to engage into those activities. So definitely they will have the psychological impairments. They will be feeling low, that I am not able to participate in all the normal day-to-day activities that I should be or I can do it. Then growth and nutrition. So when definitely if you have issues with the spine, now when the child is born, the child is very small in the height and in the size, in the weight, everywhere. But definitely slowly as the child grows, the height of the body increases, the weight of the body increases. So we require a growth of the body. So what will happen if you have any issues with the spine? The spine is bifid, the spine is not working properly. So what will happen? The growth of that spine also will be retarded. So when the growth is retarded, you will have again issues with the growth. Nutrition intake and weight gain are the loss. Weight gain and loss have been found to be problematic in children with myelomeningocele. Now why weight gain? Weight gain is because the child will now be continuously sitting. As he is having his lower limb issues, he is not able to sit, if he is able to sit with support and is not able to stand, then what will happen? He will not be able to do activities. And for growth, his body requires food. So the child will eat the food, but the food is not being consumed properly because the child is not active, right? So the issues with the weight gain will occur. Obesity can be a significant issue for children with spina bifida. Growth in these children may be influenced by growth retarding factors as a result of neurological deficit as a tethered cord syndrome. So what can be the diagnostic tests? How can we diagnose that a child has spina bifida? As I told, the ultrasound and alpha fetoprotein by aminosynthesis and maternal blood. Fine. So when you have some problem, this is the testing of AFP in the mother's blood will tell you, the presence of this will tell you that you have some issues with the development, and ultrasonography of the spine of the fetus. So if you see the ultrasonography picture, here you will be able to identify that the spine is not properly developing. So that will tell you in the ultrasonography picture that the spine is not developed, and it will be informed to the mother also, right? Now it is on mother what to do. Now what do we consider under management? Management means it is a whole sort of management. Not management means when we have to look for everything, the overall growth, the overall development of the child. Then how would we manage spina bifida? In the management, we will see the first is orthopedic management, the second is urologic management, the third is neurosurgical management, the fourth is again neurological, or we can say what can be done to improve the flaccidity, gastrointestinal management and multidisciplinary management. Now, what first thing that we will do in orthopedic management? We have seen that the child may have this club foot. Fine. This thing. We have seen that the child may have club foot, we have seen that the child may develop these deformities of the spine. So, in the orthopedic management, what do is we try to correct these deformities. Fine. First of all, we will try to prevent this, and second thing, we will try to correct the deformities. Then in the urological management, urological, as I said, when it is lower lumbar sacral area involved, then definitely you will have issues with bladder and bowel. So, there you will be consulting, or the patient will be asked to consult a urologist, where urologist can identify and give the solutions to the problem, like they can go for exercises, they can go for certain type of nutrition food, and they can also go for the treatment like catheterization and all, which will help the child to get out of the problem. Then neurosurgical management. Now, if we have seen that when it is meningeocele or myelomeningeocele, where the nerves are also coming out, then it will be surgical management, where we see that we will be able to put the nerves back to its original position. So, that will be neurosurgical management. After surgical, whatever the damage has been occurred to that nerve, that damage will cause the problem to your lower part of the body. So, that also we need to treat. Along with it, gastrointestinal management, as I said, that the growth will be retarded, and also along with it the child will also have to eat for growing, but that food will not be consumed properly. Why? Because of the lack of mobility, right? And multidisciplinary means we have to look for, as we saw, we have psychological involvement also, we have cognitive and learning behavioral issues also. So, there also we need to focus on to improve the overall development of the child. So, what will be the goal of our patient or goal of any doctor to treat the child with the spina bifida? The goal of the doctor would be, and that the patient or the child would be at least able to do his own activities by himself, right? We want our patient to be as much active, independent as possible. As I said, neurosurgical management, then orthopedic management, casting, that will help to improve the deformities, and physiotherapy management, right? So, physiotherapy management definitely includes a lot of things, like we can improve on the tone of the muscle, we can improve on the balance of the muscle, we can give on certain exercises, we can give on certain treatments, certain machinery modalities, which will help our child to get back to the normal, or at least make our child as much as independent as possible, right? So, this is what is the overall multidisciplinary management of the spina bifida is. So, hope we are clear with the concept of spina bifida, with overall clinical features, with the management and the causes of spina bifida. Thank you.